My name is Natalia Ronda. I am Dean of Allied Health and Life Sciences here at Conestoga College. It is my pleasure to welcome you to a virtual tour of the innovative Center for Medical Sciences and Biotechnology at Conestoga College. The center features cutting-edge laboratories equipped with the latest biotechnology instruments, tools, and infrastructure. These state-of-the-art facilities provide an exceptional environment to support student learning, facilitate hands-on experience, and foster innovation to ensure student success. Students from a variety of programs, including medical laboratory sciences, medical technology, biotechnology, clinical research, laboratory quality management, and many more, will receive exceptional industry-relevant training in these labs. Today, we have the privilege of unveiling our newest laboratory spaces. We are grateful to the donors and partners that made these laboratories a reality. The first space is our MLS Clinical Chemistry Hematology Laboratory, where students perform phlebotomy and practice using a variety of analyzers to perform diagnostic tests. Kathleen will be demonstrating the use of Borfen, a late coagulation analyzer, to identify clotting factors in a blood sample. Also in this space, Hillary will be demonstrating to Brandon how to practice phlebotomy using a venipuncture arm and simulated blood.
So we're going to do phlebotomy on this arm. We already have the tourniquet tied. So the next thing we're going to do is we're going to search for the vein. So we're going to palpate the spot. So you can feel that it's nice and bouncy there. And then next what we would do is we're going to cleanse the arm. The fake arm's not allowed to use alcohol, so we're just going to use water. And you want to do it in a circular motion. Just like that. And then you would toss that out. Next, we're gonna get the needle. Don't wanna poke ourselves, so we're always gonna direct it away. We would wait for the alcohol to dry, which would dry a lot faster than water. Take this off, have our tube ready, and you would anchor the vein and then insert the needle. Once that's in, you put the tube of blood in. And collect like that.
So this is one of our coagulation analyzers. This measures all the different coagulation factors in blood. So essentially how quickly or slowly you bleed and or clot. It's really important that we maintain a good level of both bleeding and clotting. You don't want to bleed too easily, you don't want to clot too easily. So yeah, this analyzer tests a variety of clotting factors. It's very easy to use. As you can see, everything is color-coded. It'll let you know exactly what it needs in order to perform each test. And yeah, this would be used in a hospital setting for a lot of people who are on anticoagulants, people who are at risk of stroke or deep vein thrombosis, things like that, to monitor their bleeding and clotting levels and to make sure that everything is kind of within that ideal range that we're looking for.
The next space is our MLS Surgical Pathology Laboratory. In this space, students perform tissue techniques used to detect cancer and other pathologies. Tammy, one of our MLS faculty members, will be using Mastro Pathology Workstation to demonstrate how thin slices of tissue are obtained from larger tissues that would have been removed during surgery to look for abnormalities.
Okay, today we are going to learn about grossing samples. So essentially in the pathology lab, this is the first stop a tissue that has come out of a patient's body would come to this area of the lab. So this is a crucial component to pathology because we would have to prepare the sample and describe it for the pathologist in order for them to understand what it looked like when it exited the patient's body. So today we have a kidney sample that has a suspected cancer lesion in it. So to start off, we would display the kidney in its entirety, look for any things that seem that could be of interest to us. It would also be important to note the measurements of the organ so that it could be part of the medical record on what it looked like when it came out of the body, and describe it in its entirety into the computer system. From there, we would take small little sections of this tissue to give representation of what it would look like underneath the microscope. So in order to do that, you would take a very sharp knife And you would cut very small pieces of the tissue into equal width and depth so that it could then go to processing. Once you're satisfied with your section, you would place it into one of these cassettes, and then you would close the cassette lid, making sure that everything is labeled appropriately. And then you would place it in the tissue cassette holder, which would then later bring the tissue to processing for further examination and sectioning.
In this space, our MLS Transfusion Medicine Histotechnology Laboratory, students learn how to prepare blood for simulated transfusions, as well as cut, stain, and observe tissue under microscopes to aid in the diagnosis of cancer and other pathologies. Hillary, one of our technologists, will be demonstrating how the Echoluminar is used for blood type and antibody screening in preparation for blood transfusions.
This is the Echoluminar. It's a transfusion medicine or blood bank analyzer. We already have our reagents on here, so once we put our sample on, it's going to tell us our blood group and if we have any red cell antibodies. So we just put our sample in here. And after about 40 minutes of the testing, it's gonna tell you your blood type. So this patient was O positive, and then they had a negative antibody screen. So we do this testing so that if they need any blood transfusions while they're in the hospital, we make sure it's safe for them and they get their appropriate blood group.
Our next space is the Applied Chemistry and Biotechnology Laboratory. In this multi-purpose laboratory, students gain hands-on experience in general chemistry techniques, as well as advanced molecular biology and biochemistry techniques using state-of-the-art equipment. Today, Ryan will be explaining to students how a distillation apparatus can be used to separate methanol from a liquid sample.
All right, so today we're doing a simple distillation. Distillation is used to separate either non-volatile solids and liquids or two miscible liquids. So what we're doing is we're boiling our distillation solution here, turning the low boiling point material into a vapor, which goes up and then condenses into a liquid down here. So it can be used in many different processes for us where we want to separate things. The number one thing that you'll see it out in industry is we do this for our crude petroleum products. So if we take oil out of the ground and we want to make that into useful things, we use a distillation process. Now it wouldn't be a simple distillation because you'd want to separate into useful things like waxes, gasolines, some of our solvents that we used are all brought out in these situations. So with this solution, we are removing methanol specifically. So you can see that we have our system heated up to about 275 for the ceramic plate. But if you look at our temperature in the thermometer here, we're stuck at what temperature there, Brennan? Yeah, just shy of 80. So that's around the boiling point of our methanol. So what we're getting is something that's distilling down here that is very rich in methanol. It's not completely methanol. Whatever the other solution is in our unknown liquid right now will also be coming out, but it'll be in a small fraction. So what we do when we're distilling the solution is we're going to want to collect it in fractions, because that first fraction will be rich in our methanol, and everything that comes off that after that will be less and less methanol as we go along.
This space is our biotechnology prep room, which is used as both a staff preparatory space as well as a student learning lab. The highlight of this space is our Malditov, a state-of-the-art instrument seen in only a small number of academic institutions across Canada. This instrument is used for fast and accurate microbial identification and to determine the most effective treatment against that microbe. Today, Jordy will be showing students how the Malditov is used to identify a bacterial strain isolated from a patient sample.
Okay, so since we've just added our bacteria of interest to our target plate from our patient sample, we're now going to place our target plate into the carrier. So I'm going to open up the MALDI's door, place it into the carrier, and then I'm going to close it. And when we press this button, the carrier is going to go into the mass spec. And what the TOF in Malditov actually stands for is time of flight. So it's then going to use that essentially to identify specific bacteria by looking at its protein profiles. And then we are going to see it compared to our library. And then the library can tell us exactly what bacteria it is. So right now it's just moving along and it's trying to find the plate. So it's going to start shooting with its lasers. The way that it works is that the TOF in MALDI-TOF actually stands for time of flight. So what happens is the laser actually hits the specific bacteria on the plate, and it basically essentially explodes the bacteria. The cell will then break into all of its different proteins, and what it's going to do is it will fly up in the air, so time of flight. And then the machine actually measures the mass based on that, and it can quantify each protein, and then what we'll do is it'll give us a genetic profile of each of the proteins that's very specific to each type of bacteria, and then we compare it to our library, which will then tell us exactly what type of bacteria is in the sample.
Our next space is the Applied Biotechnology Research Lab. This containment level 2 space is designed to perform both chemical and biological techniques commonly used for both teaching and research purposes. The centerpiece of this lab is the Attune SIDPICS flow cytometer. The flow cytometer is a powerful tool used to sort cells and help investigate cell function, including the identification of specific types of cancer. Today, Jordi will be running through a routine startup and performance test on the flow cytometer, performed regularly to aid in accuracy and calibration.
Okay, so since we use the flow cytometer all the time, it needs a lot of maintenance. So we're gonna do a performance test just to make sure that our samples are being read correctly, because it needs to make sure that the cells that we're actually looking at have the correct mass and the correct identification. So the first thing we're gonna do is check our instrument configuration. So we have all these fluorescent tags that are actually gonna be corresponding to the cell type we're looking at. And there's a filter map here, so it should correspond exactly with what's going on in there. So if you open that up, we can take a look at the different filters we have and see that they're all labeled and in the same place as we have on our filter map. So we close that up, we check the bead number, and we have now created a performance tracking fluid. So before I put that in, I'm just going to set it up right here and vortex it to mix it all around and make sure the beads are uniformly in the liquid. And then what we can do is load the tube. So I'm just gonna put it right here into the Attune SIDPICS flow cytometer, and I'm gonna lift it up, okay? And now if I click Run Performance Test, it's gonna start actually taking the performance beads up. Green means good, and you're gonna slowly see that it's gonna start showing what the beads look like on here. So it's just looking for the beads right now, and then it will start populating our graphs. So right now, each of these dots actually represents a cell. So we put those beads in that are mimicking our cells. So it's just kind of tracking to make sure, because we know it's a known size and a known volume. So once it populates this graph, it should correspond to what we've done in the past, just to make sure that the performance is statistically similar.
This space is our biotechnology clean room. This ISO Class 8 certified clean room maximizes sterile conditions through features such as positive pressure, a series of HEPA filters, biological safety cabinets, and a gray room where students properly don and doff appropriate PPE. Today, Lisa will be demonstrating the use of biological safety cabinets to perform routine cell culture techniques.
So today I'm going to demonstrate how to use a biological safety cabinet. The biological safety cabinet is a piece of equipment that protects both the worker and the environment from any biohazardous or infectious agents we work with, as well as it protects the product we're working with. So it helps to decrease any contamination and improve quality control or ensure quality control. So the first thing I need to do is sanitize and spray down the hood. So I use 70% ethanol. And we use a lot of it. You want to make sure that it's all sterile before we work in here. So then we also have to spray everything we're working with. So we have our shaker flask. Our cells. So now that we have all our equipment and our cells ready to go, the last thing we need to do is sterilize our hands. We need to make sure that our hands are sterile as we go in to the hood. So you want to take the ethanol and spray them very well. And make sure you get all around your gloves. And after you do this, you don't want to touch anything. So you're going to sit and move around and then go into the hood. Once you're in the hood, You want to minimize movement to keep the airflow going, and you don't want to have your hands or your arms pass over any open jars. So we're going to have the jars closed until we need to. The other thing you want to do is you want to set up your equipment the best way that works for you. So because I'm right-handed, I put all my clean materials on the right side and anything dirty on the left, so I can move in this movement. Even if you're right-handed, you may prefer to move the other way, and if you're left-handed, you may prefer to go the opposite. That's really up to you. So I'm going to open the shaker flask first, just loosen up the cap, don't need that yet, as well as the media bottle. All right, so now our media is in there. I put this back into, move that over there, and we'll close up our media bottle. We're done with it, so we'll also move it over to the left. The next thing we need to do is add our cells to the media to passage the new flask. So we need to add 800 microliters of cells. Again, you want to try not to go over your tips because they're sterile. So we're just going to open them. I'm going to take one, close back the box. Now we have our cells, which we already counted. Now because our cells are living, we want to try to get it as much as we can directly into the media. Close that. Over there. Shut the lid, swirl it around a bit, and now we're done passaging. So we have to now take our cells out of the BSE. Do you want to grab the label, Janine? I'm going to put it on. Perfect. And now we'll put it into the 27-degree incubator. To grow the cells, you want to make sure that cap is a little loose. Not completely loose that when it shakes it's going to fall off, but as you go down to the incubator, you just want to give it a, make sure it's a little bit loose, and then we can close it. Make sure it's shaking. Yep.
The last space is our analytical instrumentation laboratory, where students get hands-on experience using state-of-the-art chemistry instruments. Ian will be demonstrating how to calibrate our Orbitrap Explorers liquid chromatography mass spec to quantify cholesterol from a blood sample.
Okay, so today we're going to be using the Orbitrap liquid chromatography mass spectrometer to analyze for cholesterol. So you guys prepared our standard curve. So we're going to go into the auto sampler. We're going to remove tray R and place our standard curve in. And replace the tray into the auto sampler. So while the auto sampler is registering the tray, we're going to have a quick look to make sure the column is set at the right length. So you can see here I have 1.985 millimeters. This is taken from the camera on the electrospray source. And I can see that the tip of the column is the proper distance away from the inlet source. We're also going to check system stability. So our goal here is to make sure that everything here is consistent. This line is a 2% relative standard deviation from analysis to analysis, and we can see we're under 2% RSD, which means that we have a stable system. And then we'll move on to building sequence and running the injections overnight.
As we conclude this virtual tour, I invite you to join us in imagining the future possibilities of the space. In each lab, you've witnessed the opportunities for skill development that prepares strong graduates not only for the jobs of today, but for the jobs of the future. We're very proud to offer this cutting-edge learning experience to our students. Guided by our experienced faculty in these lab spaces, our graduates will develop the necessary skills to enter the healthcare industry and will directly contribute to the health of our communities. It's a future that we're not only excited to be a part of, but also thrilled to share with you. Thank you for joining us on this tour.